Hi, I'm Jennifer Foley and I'm a clinical neuropsychologist at the National Hospital for Neurology and Neurosurgery, and I'm going to talk to you today about anxiety and depression in Parkinson's. So we know that just below the surface there are lots of non-motor symptoms lurking, such as in anxiety and depression. We know that they can affect the way obviously the patient feels, but also their disease progression and hasten worser outcomes for people with Parkinson's. We know that it's very important to do things about these symptoms. And in the 2018 Parkinson's UK report, they found that many people described anxiety, for example, as the worst aspect of their condition. And I don't know if you can see this, but 75% of people described these sort of non-motor symptoms as actually making everything else worse and it being the worst aspect of the condition. So it really has this great impact on people with Parkinson's, anxiety and depression. And today I'm going to talk about what's a normal way to feel with Parkinson's, and then what is what we would call anxiety disorder or depression, and how we should go about trying to help people manage their mood effectively. So when you get diagnosed with a chronic condition, obviously it's very normal to feel lots of different negative feelings. It's a major life transition to go from healthy to not very healthy, and it requires adaptation to changes in function and roles across multiple life domains. And it can be thought of as a grieving process and involving similar grief steps to the sort of normal grief processing. And it's an ongoing process. So obviously, people with Parkinson's don't just experience one sort of change. They experience lots of different subsequent changes. And some of those will be bigger than others. So, for example, I met someone recently who would cope very well for like 20 years with Parkinson's. But now that the Parkinson's has affected their ability to leave the house on their own, they're really struggling. And so, these sorts of different changes keep continually occurring throughout Parkinson's. It's a real test of the person's ability to adapt. And their ability to adapt will obviously vary according to the specific challenges faced and the psychological resources available. So having a diagnosis of a chronic condition may be a huge challenge for one person, but for another person it doesn't really affect them that much. But the actual specific impact upon either their body or their mind can be a huge hurdle for them that can be very difficult to overcome. And obviously, depending what else is going on in your life, that will have an impact on the sort of ability you have to cope with these sorts of challenges. And also access to social support. So who else is available to support that individual? So obviously it's very normal to struggle to come to terms with a neurological condition, having a new diagnosis and having to come to terms with the new me. And people will go through different stages, as we said, like a grieving process. And so it might start off with lots of very anxious thoughts, very difficult thoughts of what does this mean for me, what's going to happen in the future. That's a real driving concern of nearly every person with Parkinson's. But then over time, people might sort of settle and become more focused on how they can cope best with the condition, and maybe what needs to change so they can still enjoy doing the things that they enjoy. And but not everyone adjusts to Parkinson's, and a significant percentage of people will struggle and will have feelings that might be considered to be an anxiety disorder or depression. And so this study from King's in 2011 found that a huge proportion of people express anxiety disorders, and mostly these might manifest as persistent worry. So often these people will be worriers by nature, and they will just become so much more worried. So it's just a constant sense of concern. There's also social anxiety, where people with Parkinson's will feel very self-conscious in social groups, and sort of really worry about walking into new encounters and wondering about what people think of them. And then there's episodic panic, and this is often occurring when medication is wearing off, when they're when their medication levels are low, and then they're much more symptomatic. And often people can become very distressed during these phases, these off periods, and become even suicidal in these moments. But then it will pass as soon as the medication sort of comes online. There can also be sort of anticipatory panic, or anticipatory anxiety, so people worrying in advance of these off periods, or even sort of not doing anything all day just in case these off periods occur, and so it can sort of spiral from there. And these sorts of symptoms, these sort of anxiety symptoms, can be accompanied by low mood. Depression on its own is a lot less common. It tends to occur with the anxiety, as well as feelings of apathy, so this not wanting to do anything. Apathy tends to occur with either anxiety or low mood. Again, it can occur on its own, but it's a lot less common. So what causes these sorts of changes? So these changes are caused by obviously the changes in the brain, the neurotransmitters, and that includes not only dopamine but also serotonin and noradrenaline, these sorts of neurotransmitters that will affect not only the movement in the body, but also the way that the brain responds, or also mood. It has a big impact on mood. There's also medication side effects, so depending on where you are in your medication cycle, it might have an impact on your mood. But also, and I think more importantly than either of the two previously mentioned causes, is the psychological impact of the disease, as well as the person's previous mental health history. So what is the psychological impact of the disease? So a lot of people that I speak to, as I said, are very anxious about the future, and part of that is because they consider Parkinson's to be completely uncontrollable. And really, if you think about it, it's hard to imagine it being anything but, because you're given very little information on the expected disease trajectory, very little information on how to expect the future to be, little information on how to cope or how to optimize your outcome with Parkinson's. You have a very poor sense of control over your symptoms, and your medication regime is constantly changing. So every time you go back to the doctor, you might get more medication or a different sort of dosage, different time to take your medication. So everything is constantly changing, and you're given very little coping mechanisms. Another very common way to feel is feeling of no longer being the same person. So that can often be to do with sort of internalized stigma or societal stigma about being a person that is not functioning 100%, or that has a sort of visible difference. There's also changes in social, occupational, and functional roles, which will have an impact on one's sense of self, as well as increasing disability and perhaps dependence upon others. So there's that real sense of shift in who am I, which can be very hard for people to cope with. And I think when that does happen, that tends to cause a bit more of that depressive response as opposed to an anxiety response. And what I find quite difficult is when people talk about an anxiety depression being inherent to Parkinson's, so they really feel that there's nothing that they can do about it, and they place, I feel, a too great an emphasis on the biological contribution, which can then lead to this sort of misunderstanding that there's nothing you can do about it, and that psychological distress is inevitable and incurable, and so you just have to suffer. And I think this really reduces people's sense of self-efficacy, their self-management, and their engagement with any mental health or physical or disease intervention, which can really reduce people's outcomes. It can really make outcomes a lot worse. So what to do about it? So in psychology, we would think of a matched care model, where we think that, normal distress is normal. You don't need to do anything about it. It's just, you might need to have a talk to that person and just talk to them about that, and explain that this is a normal way to feel. It's normal to feel distressed when you get given a life-changing diagnosis, and it will take time to accommodate this, and it will take time just for you to sort of adapt and cope. But when people don't adapt, eventually, when they don't cope, then this is when things like counselling or NHS talking therapies can be very useful. You can have a self-referral or a professional's referral to these sorts of services. And when there are very Parkinson-specific issues, or where maybe cognition is impacting people's ability to benefit from talking therapies, or when the concern is very specifically related to Parkinson's, the neuropsychology can be very helpful. Not everyone has access to neuropsychology, which we're aware of, but this is they're in a very good position. We are in a very good position to help people with Parkinson's because of our training in clinical psychology and therapeutic interventions, but also in the neurology associated with Parkinson's disease. And when there are very complex conditions, such as anxious delusional states, then obviously we need a multidisciplinary team approach where we involve the medics, nurses, as well as psychiatry, psychology, and counsellors to really help people sort of cope, often in an inpatient admission. But there's lots that people can do to help themselves with Parkinson's to manage their own mood. And I would really say this is like the bulk of when I'm talking to patients, I'm really helping them focus on how to self-manage. So what can they do to help themselves? I guess what I'm thinking about here is really trying to give people the tools that they haven't been given thus far on how to manage, how to cope with the sense of constant change, how to really sort of keep the boat afloat in the sort of constantly choppy water of what it's like to live with a chronic neurological condition. And how does one do this? So what I really try to, and I'm not just saying this because of this presentation, but I really feel that the main thing that people should be doing with Parkinson's, not only to help their condition, but also to help their mental health, is exercise. So the more hot and sweaty exercise that they do, they feel better. They feel like they're doing something to help themselves. They're getting a sense of control back over their condition. They're allowing themselves to feel these positive endorphins from exercise. And often people that I know that become very involved in exercise describe themselves as being fitter than they've ever been before. They have this whole new social group that's associated with this new exercise that they're doing. And, I've had some patients tell me that they're so thankful that they have Parkinson's because they developed this whole new sense of self through this exercise. And so I really try to enable people to access exercise as much as they can. And often it can be, difficult. People might not have ever done any exercise, really committed to an exercise regime, or they might just be very solitary, and so the idea of a group exercise has no interest, or they might be very frightened of going to exercise classes because they're worried about seeing other people with Parkinson's who are further on in the condition. And so it's important to really try to think about exercise in more detail, which we'll go on to do. But in addition, it's about sort of scheduling rewarding activities, and it's about socializing, it's about having someone to talk to, and it's about taking time to de-stress and to really, give yourself time off, and thinking positively, challenging some of those negative thoughts. Let's go into those in a bit more detail. So why should people exercise? So I think what's important is to tell people or to give people a reason to exercise. So when I tell people that, well, do you know what, the one thing that's been really shown to slow down the progression, the thing that you can do that can really help you with your progression of your Parkinson's is exercise, then people tend to feel very much more empowered, and you can really hear the change in their voice. And so people feel really good when they're told that there is this rationale for exercising in Parkinson's. Not only does it help their progression of the disease, it really slows it down, but also it really helps them feel better, and it also helps them body to de-stress, and that will help it easier for them to sleep. And so when this is all laid out to them, it's a bit of a no-brainer that they should be exercising, and particularly increasing this sense of control. As we said, that's a very important part of an intervention for people with Parkinson's. But it's about identifying the right exercise, isn't it? It's about whether it's that group-based exercise that enables that social cohesion that is very important in Parkinson's for many people, or whether it's just trying to incorporate exercise as much as they can whilst they sort of perhaps ignore the fact that they have Parkinson's for the first year or so. And that might be doing sort of high intense training at home. Or for people who are more progressed, it might be doing some chair-based exercise, such as that in the English National Ballet. There's lots of different types of exercising. According to age group, it might be breakdancing, or it might be, ping pong, but it has to be the right exercise for the person to really keep them engaged. And I think it's really important to try to set a goal for their exercise, and then make sure it's a realistic goal. So, for example, this person their goal is to feel less anxious about leaving the house. I know I've achieved this if I'm going for a walk around the local park or visiting the gym at least twice a week. I'm motivated to work towards this goal because it feels realistic, and I want to build my confidence. So they have a specific goal that they're going to try and achieve over this. In our case, it's an 8-week program, but we really try to help them engage in this exercise increasing process. And we help them try to identify how the exercise affects their emotions. So by trying to sort of sketch out what their weekly routine is, and then trying to monitor how they feel at different stages after these exercises or after these activities, they can start to identify that actually their mood is impacted by exercise, and it helps build in the rationale, or helps them engage in the rationale for exercising, but also helps them build their awareness. So is their mood better when they're exercising indoors or outdoors? What activities gave them the biggest sense of achievement or pleasure? And what they find was the relationship between their mood and their activity levels. So the more that they can identify this for themselves, then the more they're going to be likely to take this on long term. But as we said, it's also important to do these rewarding activities that gives them both pleasure and a sense of mastery. So this pleasure is the sense of just doing things that they enjoy, maybe some massage, or listening to music that they enjoy, but also a sense of mastery where they feel they're actually doing something that makes them feel good about themselves. So maybe it's taking part in research, or maybe learning a new skill. It might be going to an interesting lecture that they enjoy. It's about something that sort of accords with their sense of self and a sense of achievement that comes from that. But it's also important to have someone to talk to, because obviously it's very difficult to cope with a neurological condition, one that is progressive, and it will bring up lots of difficult thoughts and feelings at different times, and that's all completely normal. So it's important to have someone to talk to about that. It doesn't have to be a trained professional. It could be friends or family, but it's important to have a confidant. And when people don't have a confidant, there isn't someone that they can talk to, then that is when a trained professional is very helpful. But it's important to keep your social biome up as much as possible. So it's having activity partners, perhaps people that you go to the cinema with, sort of enablers to do the things that you like to do, as well as Parkinson's communities, and helping them identify the fact that there is a Parkinson's community out there that's sort of ready and waiting for them to join. And then it's thinking about stress control. So it's things like mindfulness, or progressive muscular relaxation, meditation, these sorts of things that can really help the person sort of achieve a better sense of knowledge of how to reduce their body's response to stress. The more that they feel on top of their body's response to stress, the better they'll feel in anxiety-provoking situations, and less likely for their anxiety to then increase their Parkinsonian symptoms when they're feeling stressed. And also challenging negativity. So a lot of people with Parkinson's will feel very anxious about doing things. They might catastrophize, for example. That's very common what we call thought errors in cognitive behavioral therapy. So catastrophizing, where you really feel that you're unable to cope with something that could come up. You might overestimate the chance of disaster, and overestimate or underestimate your sense of coping abilities. And so an example of this will be, I can't handle this, or if I get anxious, I won't be able to cope, or this new feeling must mean my condition is getting worse. And by getting people to sort of thought check by asking themselves some questions such as, are you blowing things out of proportion? Are you overestimating the chance of a negative outcome, or underestimating your ability to cope? Starts to help people see, or to step back from their thinking to try to see a more balanced way of approaching a new situation. So helping them think something through, and what is the most realistic outcome, and what is most likely to happen, and would it be the end of the world if it did happen, and would you be likely to cope? So reducing some of the emotion attached to some of these thoughts by actually debating some of these thoughts and coming up with more balanced views. So in summary, really, mood changes are very common in Parkinson's. Self-management of mood involves exercise. People may be helped into exercise and to overcome some of that low mood or that low motivation by helping them understand the rationale, by helping them identify the right exercise, by helping them work towards a personal goal, and then monitoring its impact on mood. Mood can also be helped by improving social and occupational engagement through these sorts of pleasurable and activities that afford a sense of mastery or achievement, by challenging negative thoughts, and by effective stress control. And so a lot of the things that I do are really spent sort of helping people to identify this for themselves, or to give them some advice along these lines. And so I think that this is probably the most effective way of helping people with Parkinson's to help themselves. So I hope that's helpful. Thanks very much.